Hello everyone, welcome to today's webinar on posology. So this posology, it is not only important for pharmacy students, however, this is also important for those people who want to calculate the doses from the given official dose. Okay, so I'm Mrs. Nagaharita, pursuing my PhD in pharmaceutics, and I'm an associate professor in the Department of Pharmaceutics. So today, in this particular webinar, we are going to study about complete posology, like what the posology actually is and why we have to calculate the doses, why not a single dose can be given. So there are certain factors or there are certain points which are going to affect this particular dose. That is why we are not able to give the same dose for all the people. So what are those factors affecting? So if you can see the contents, it will be clear for you. So we are going to see the introduction, what actually the posology is, then factors influencing the dose. Okay, so why only same dose cannot be given to all the patients. So there will be certain around 14 to 15 factors are there. And then calculation of the doses. The doses will be calculated on three criteria, right? So the first one is the age, then the body weight, and the third one is the body surface area, which we rarely use. Okay, so based on these three parameters, we are going to calculate the dose. And then few practice problems like how far you have understood the webinar. It will be understood by the end of the webinar if you could be able to calculate the problems that I have given in the last slide. Right. So coming to the introduction part, so this word posology, if you observe various words that are present in your pharmacy, they are mainly from the Greek words or the Latin words, isn't it? So here, this word posology is nothing but it is from the Greek words. So it is a combination of two words. So what are those two? Posos, that means how much, and then logos, that means it is sciences. So the science which is dealing with how much, that means how much it has to be taken. Suppose your mama is preparing some dish, okay, without knowing how much to prepare, she cannot prepare for all the people who are present at your home, is it not? So she is also dealing with the posology in the everyday life, right? So here, how much sciences, that means how much amount of the dose, whatever it may be, when you are calculating for how much, it is called as a posology. So in the pharmaceutical related thing, in the pharmacy department or in the pharmacy stream, as you are calculating it with the dose, okay, so we say that how much dose is required to produce certain pharmacological action, because the ultimate aim or the ultimate objective for us is to have some pharmacological action which leads to the therapeutic effect. So the complete definition would be like, it is a branch of medical sciences which deals with the dose or quantity of drugs which can be administered to a patient to get the desired pharmacological action. Okay, so whatever the pharmacological action that is desired for you, suppose if you are taking an antihypertensive drug, okay, the students who are who have already done their BPharm and PharmD first year would well understand this. However, those students who are in the webinar, the people who are in the first years, it may be little new for you, but this particular posology, if you understand, and this is a very important part of the pharmaceutics, where you'll get at least two questions from this topic in your GPAT and NIPER exams. 2 marks is not very little thing, okay? Because even half a mark decides your rank, right? So here the complete definition is, it is a branch of medical sciences which deals with the dose or quantity of the drugs. Dose is nothing but your quantity, and that can be administered to the patient to get the desired pharmacological action. So whenever desired, if you are giving antihypertensive drug, reduction in the blood pressure is your desired pharmacological action. If you are giving anti-diabetic drug, reduction in the blood glucose level is your desired pharmacological action. If I give anti-diabetic drug and if I see there is a reduction in the blood pressure, no, that is not a desired pharmacological action. Okay, that is something like which we call it as an adverse reaction, is it not? So And then, so dose cannot be fixed randomly. Obviously, the dose cannot be fixed randomly. See, as this is Diwali season, first of all, I wish you all a very happy Diwali. Being a festival, as you have come today for today's webinar, I can understand how much you are interested towards the learning. Okay, so recently we have been to a shop to buy the crackers. So when we were buying the crackers, the rate, MRP rate on the crackers is something else, and they are randomly putting the rates for us. Okay, so in the same way, we cannot randomly, we cannot put the dose for the patients by seeing a particular patient. Okay, he is tall enough, he is stout enough, I can give some 50 mg of the drug. No, not at all. You cannot fix the dose randomly, because if there is a change in the dose, okay, or if there is a change in the dosing interval also, so you will be having a word called as a dosage regimen. Okay, so the dosage regimen is nothing but how much amount of the dose has to be given at what time intervals. Okay, very easy example I would like to give you here is a paracetamol. Suppose if any patient is suffering from fever, right? So that particular patient, when we prescribe a medication, what we would prescribe, suppose he is an adult patient, we prescribe 650 mg of the drug 4 times in a day or once in every 6 hours. Is it not? So 650 mg is called as a dose, and once in every 6 hours is called as a dosing interval. So both together, 650 mg once in 6 hours or 4 times in a day is called as a dosage regimen. So the combination of the dose along with that of the dosing interval, it is called as a dosage regimen. Okay, so this dosage regimen has to be fixed based on certain factors. Immediately we will see in the other slides. Okay, so that is why we say that the doses cannot be fixed randomly. So where from we get the doses? The doses, the official doses, we can get them from certain official books like IP, European Pharmacopoeia, British Pharmacopoeia, USP. Okay, so like that we will be getting from various official books. However, the dose that is given in those official books, it is for an adult patient. It is not for the children. Okay, it is for the adult patient. But do we get only the adult patients as the patients? No, not at all. From the newborn, like maybe the hours age of the patient till the 9600, more than 100 years of the patient also we may get. Is it not? So there will be only the dose given for the adult in the official books, that too only the oral administration, which is for 24 hours. Okay, so that as it is given only for the adult doses, now by taking it as a base, you have to calculate the doses for the patients that you're dealing with, whether they are the children or whether they are the elderly people or whether they are the old people, depending upon the age of the patient. Now you have to calculate by taking this as a base, right? So not only the oral administration, certain times there will be other routes of administration as well. You know, like a topical administration will be there, parenteral will be there, optic will be there, otic will be there, okay, epidural will be there. So there will be various routes of administration that are present. So sometimes even for various other routes also some relevant doses will be given. But however, all the doses, maximum 95% of the doses that were given in the official books will be for the adult dose. Taking that as a base, you have to calculate for the uh, young people or even for the other age groups of the people. So dose and dosage regimen would be obviously the responsibility of the prescriber. So in India at present, the prescriber is nothing but the physician, the doctor, isn't it? So till now, even our PharmD graduates also didn't get the permission of prescribing the medications. Hopefully, we are going to get soon. However, here the dose and the dosage regimen, it has to be given and it is the responsibility of the doctor. However, being a pharmacist, it is the responsibility of the pharmacist before dispensing the drugs, that is whether the dose and dosage regimen is proper or not. Yes, it is your responsibility. Okay, so here, why the prescriber, why the pharmacist is also responsible, because you are a part of the healthcare family where you're also the responsible for the health of the society. Suppose if you find any drawback, or if you find any fault in the dosage regimen of the doses, you can either call to the doctor and ask if it has been done by a mistake, or if it has been written by mistake, or if you have understood it by mistake, because we doesn't understand the usually we doesn't understand the writing of a physician, is it not? So the clarification has to be taken from the physician, and then it has to be dispensed. If anything mistake has happened, everyone are human beings, there is a chance of taking a mistake. So you have to take it on your side, you have to take the responsibility from your side, and then you have to dispense the drugs. So this is all about the introduction to the posology. Till now, if you have any doubts, you can just type your doubts in the chat box, so that we'll get back to you at the end of the webinar. And then coming to the most important part of the webinar, that is the factors influencing dose. Yes. See, whenever the student see certain heading like factors influencing dose, or factors influencing absorption, factors influencing distribution, like this, if they see, they generally tend to avoid these factors, feeling that all the factors would be the same. Why we have to read? See, if any third years and fourth year students are there in the webinar, you would understand from the pharmacology that whenever the adverse reactions comes, you would be usually writing it as nausea and vomiting. That's all. Irrespective of whatever the adverse reactions that the particular drug have, you'll be writing nausea, vomiting. So in the same way, you'll be feeling that all the factors would be the same. So what is the use of studying? But no, absolutely no. When you really understand what is the importance of a factor that is influencing something, the whole concept becomes very, very, very easy for you. Okay, and it also leads you, like it also takes you for easy understanding of the concept, at the same time easy execution of the topic. Okay, so why I say the execution? Because once you are aware of this particular topic, in future, not only the pharmacy student, even a regular student should also understand how the dose has to be calculated for the children. So because sometimes what we do is, whenever we go to the doctor would write the dose and everything. After coming home, we forget whether we really listen to the doctor properly or not. So at that time, this kind of simple tips will really help you in deciding how much dose of the drug has to be given, right? So the optimum dose to show the therapeutic response varies from person to person. Really? Oh my God, why the therapeutic response varies from person to person? Obviously, because there are various factors which are affecting that therapeutic response in the body. Here, posology, we are reading, it is only the basics of the dose. As you proceed with your semesters, you'll go depth into the topic, like how the therapeutic response of the drug is being affected by various factors inside the body. All right, especially in biopharmaceutics and pharmacokinetics, you'll understand in a better and 100% way. Okay, but now here you have to remember, being in the first year student, you can remember that the therapeutic response in the body, like therapeutic response of any drug, it differs from person to the person. If it is like I have taken the paracetamol 650 mg because I'm suffering from fever, if the fever has subsided in 3 hours for me, okay, it could not be same in you. It may take either 2 hours, or it may take even 5 hours for you. What is the reason? I have taken the 650 mg. You have also taken 650 mg. Why there is a change in the therapeutic response between you and me? That means there is some factor affecting the action of drug inside your body and inside my body. So those factors only we are going to discuss. And individual varies both in degree as well as the character of the response produced by the drug. That is what I said just now. Why the dose of the drug is not showing equal or the similar therapeutic response both in you and me. Okay, because a person is different. Their metabolic makeup is different. Their tolerance is different. Okay, when you see the factors, you will really wonder Oh my God, there so many factors which are going to influence the dose. Hence, the doses will be given in ranges in official literature. Absolutely. Tomorrow, when you go back to your college, please go to the library and open Indian Pharmacopoeia. Definitely, every college library would have Indian Pharmacopoeia. You just open and you see the dose of a drug. It would be always given in the range, never a pinpoint dose would be given. Like 50 mg to 100 mg or 40 mg to 60 mg. Like that, the range would be given. Never a pinpoint dose would be given for the drugs, because it says that there are certain factors which are influencing the dose. You please calculate those factors and then accordingly you please give the drug to a patient. So minimum to maximum dose they will be giving in the ranges, never a pinpoint. So the range is usually based on average requirements of an adult patient. Another important point you have to remember here. So that range is only for the adult patient, not for the children or the old people. Okay, so based on the range that has been given for the adult people or the adult patient, now you have to correlate and now you have to calculate them for the children and the elderly people. Okay, so the 2 points here, the focus points that you have to catch up here is the dose will be always given in a range in the official pharmacopoeias, and that range of the dose is only for the based upon the adult patient requirements, but not the children or the elderly people. So now let us see what are all the factors that are influencing this particular posology or the dose of a drug. One after the other we are going to see. Okay. So the first one is the age of the patient. So coming to the age of the patient, obviously, so here when you just see, let me just on the pointer. So when you just see here the various ages of the people who are present here, so it starts from infant and it is moving towards the elderly people. So we have all the age groups of the people. So when you see the children and old people, they require less dose of the drug, because in children, the organs have not been developed properly. However, in the old people, the organs have been deteriorating slowly. The action or the strength or the capacity of the organs is being deteriorating slowly. So that is why in children as well as in the elderly people, there will be lot of differences when you compare with that of the adult people. So, for example, the children can tolerate larger amounts of belladonna and ethanol, whereas elderly patients, they are very much sensitive to hypnotics and tranquilizers. These are just examples which I have given here to write it in your examination. But however, there would be n number of examples. Okay, so if you are having various age groups of the people in your home, you can understand that. For an infant, do you give, like for a very young child, do you give a paracetamol tablet? No, not obviously. Okay, you will be giving a paracetamol suspension. Is it not? And for adult patient, you can take a paracetamol tablet. However, for older people who have the difficulty in swallowing, you would be giving the fast disintegrating tablet or oral disintegrating tablet. Like you take the tablet, you put it in a tumbler of water, you'll mix it and then you will give it to the patient so that they can swallow easily. Because the throat of the elder patients would be very dry, so that they cannot swallow properly. Okay, so in that way, for various groups of various age groups of the people, you would be giving different dosage forms. So here just two examples which you can mention them in the examination. And then the second factor is the gender. That is whether he is a woman, whether he is a man or she is a woman. Okay, so women does not respond the way men does for all the types of the drugs. And also in women, there will be various stages of the life like menstruation, pregnancy, lactation, menopause. So all these stages, they are interrelated or they are correlated with that of the hormonal discharge inside the body. Okay, hormonal release inside the body. So the hormones have a very major impact on the therapeutic response of the drugs that they are showing. Okay, so here the men does not have those stages, so we need not worry about how these drugs will uh, function during that stage. So, for example, here, as I said, there will be menstruation, pregnancy, and lactation. If we take these three as the examples, the first one is a menstruation. During menstruation, the purgatives should not be given. Purgatives like aloe vera. Okay, purgatives are nothing but where there will be a free movement of the stools. Okay, and urine. So as the person or as the woman is already suffering with the this discharges, blood discharges, you cannot give the purgatives for the patients who are in menstruation. However, during pregnancy, the drugs which causes the relaxation of the uterine muscles, okay, which causes the relaxation of the uterine muscles, they should not be given for the persons who are pregnant. For example, they are the anti-malarial drugs or ergot alkaloids. Those are the examples of the drugs which causes uterine relaxation. And then during lactation, obviously, this is a very common thing, like the drugs which excrete through the milk. Yes, the mammary glands are also one of the routes of excretion other than your kidneys, liver, sweat, saliva glands, salivary glands like that. Even the mammary glands are also one of the excretory organs. So the drugs which excrete through the mammary glands, that is through the milk, they should not be given for the patients who are under lactation, because that drug would be taken by the infant who is under lactation, right? So for example, antihistamines, morphines, the most common example and favorite example is the tetracyclines, which will excrete through the milk. Okay. And then the third factor that we have is a body weight. Yes, this one could be the very common factor which you would consider while giving the medication. Okay. Because generally the average dose will be given as mg per kg. That means 2 mg per kg. If you are weighing about 50 kgs, then how much mg you have to take? 100 mg of the drug has to be taken. So in general, the drug would be, dose of the drug would be given in relation with that of the weight of the patient. So mg per kg. If a person is weighing only 25 kgs, then you go for only 50 mg of the drug. So that is why the body weight. That is the reason when you go to the physician, they'll ask your age. They'll ask your name. And then the second one is they'll be asking your, of course, they'll be writing your gender. And then the third one is they'll be asking your age. And then they'll be asking your weight. They will check your weight. What for? Do they have any habit of writing age, weight, and all those things? No. For this reason only, they'll be asking you to write the age, weight, and also sometimes during certain medications like for cancer treatment and all those things, they would ask for the height of the patient as well. You'll understand it soon why the height of the patient has to be given. Okay. And then other than mg per kg, some doses of the drugs would also be given, like say 10 mg of the drug has to be given for the patient weighing from 50 to 100 kgs. So the range would be given. So from 50 to 100 kgs, certain amount of the drug has to be given, and from 80 to 100, certain amount of the drug has to be given. So the range of the weight will be given. And then the fourth factor is the route of administration. Very, 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 very important one. Being a science student or being a student in the healthcare, you should know what are these routes of administration and how the route of administration is affecting the therapeutic response of the drug. Okay, so this itself is a very huge topic, but I just tell you to remember simply the common route of administration for any type of the drug is oral administration. Okay, so it could be either a tablet, it could be a capsule, it could be a powder, anything. It could be a solution. Okay, so the common route of administration is a oral administration. However, we have various administrations like ocular, that means through the eye. Inhalation means through the nose. Oral administration through the mouth. Sublingual, underneath the tongue. Buccal, in the cheek, which you keep in the cheek. Transdermal patch, which you paste it on the skin. Epidural, that is to the spinal cord. Rectal, that is through the rectum. Topical, that is through the skin. And parenteral, where it comes IV, IM, and SC, that is intravenous, intramuscular, and subcutaneous. And otic is nothing but through the ears, the administration through the ears. Okay, so here at this point of time, you can remember the administration as oral and parenteral. So the oral administration of the drug is nothing but through the oral cavity, where the drug has to go into the gastric environment, that is, it has to go into your stomach and then into intestine, and then it will be distributed into the blood, which we call it as a systemic circulation. There it gets absorbed. However, through the parenteral administration, especially through IV, intravenous, okay? So especially through intravenous is nothing but through the vein, okay? So you'll have the veins here, or at the front portion of your elbow, you'll be having the veins. Through that veins, there will be administration of the drug. When the drug is administered through the veins, the drug will directly enter into the systemic circulation. Okay, the drug will be directly entering into the systemic circulation. And one point you have to, what is all this systemic circulation and all? Whenever the drug is present in the systemic circulation only, it can show its pharmacological action. In other areas, it cannot show its pharmacological action. Okay, so when you are in your classroom only, you can listen to your lecturer's lecture. If you are somewhere in the balcony or somewhere in the canteen, you cannot listen to the lecturer's lecture. Of course, you cannot go through the webinar. You can go through the webinars like this, but however, in classroom teaching, if you are present in the classroom itself, you can listen to your teacher, isn't it? So here, the drug, if it is present in the systemic circulation only, it can show its pharmacological action. Okay. So for oral dosage, all right, for oral dosage, if certain amount of the drug is given, say 100 mg of the drug is given, for IV, how much amount of the drug is given? Can it be given exactly as 100, or it has to be given more than 100 or less than 100? You just think about it for 2 seconds and you answer yourself. Now I'll tell the correct answer. So as if your answer, if you thought the answer would be less than 100 mg, then absolutely you're right, and applause for you, right? So here, why less than 100 mg it has to be given? Because the drug, it is directly entering into the blood. However, the drug which is given through the oral route, first it is entering into the stomach, then into the intestine, and then into the systemic circulation. So a long procedure is there for it to reach the systemic circulation. However, through IV, it is directly entering into the systemic circulation. Clear? So that is why, depending upon the route of the administration also, the dose differs. Right. Going to the next factor, it is the time of administration. Very, very important. And this one would be experienced by those people who have the elderly people at your home. Okay, believe me. So doctor would say the patient to take the medication after food. But they would feel, why I have to take after the food? What is the problem if I take it before food? Okay, I'll take before food. Anyhow, my drug is entering into the body. What's wrong? I will take it, no problem. Yes, there is a problem, because the food that is present inside the digestive system or the food that is present in the stomach, definitely it is going to affect the absorption of your drug. Okay, and some drugs which causes the GI irritation, because there will be the gastric juices that are present in the stomach, and because of the irritation that is caused by those drugs, they cannot be absorbed properly. Okay, so here I have given few examples like iron, arsenic acid, cod liver oil. They should be always taken after the meals, whereas there will be certain antacids which have to be taken before the meals, because first it is going to suppress the gastric content that is present in the stomach. Then you can take the food then the patient won't feel like bloating or having some burning sensation in the stomach. So now, like afterwards, if any of your parents or grandparents say that no problem at whatever the time I can take, no. You just make them sit and you make them understand what is the importance of this. The counseling, the change and everything should start from your own home self. Clear? Right. And then the next factor we have is the environmental factors. Environmental factors is not a rainy day or sunny day or winter. Yes, of course. The winter, like cold conditions and hot conditions do have the influence on the dose. But here we are going to see about the day, sunlight conditions and the dark conditions, day and night. Okay. During the daylight, it will be faster. The drug absorption will be faster for certain drugs called as a stimulating drugs, okay, which are going to cause some exaggeration or which are going to cause some stimulation in the body. For those type of the drugs, the absorption will be maximum during the daylight. At the same time, if you are giving those drugs which are highly stimulant during the night time, they won't work properly. Okay, because the darkness or the light, it is going to produce a component called as a melatonin. Okay, so that melatonin have the influence on the absorption of the drugs. So during the daylight, the stimulants would work very nicely. However, the hypnotics like uh, antidepressants, okay, like that, they may not work properly during the daylight. Okay, so here I have given an example like barbiturate required more during the daytime than nighttime. That means if 10 mg of the barbiturate is required at nighttime, more than 10 mg would be required during the daytime to show the same therapeutic response. And alcohol better tolerated in cold environment than in summer, because once the alcohol has been taken, the body gets heated up. Okay, so when the body gets heated up, it would be good when it is taken in the cold environments rather than taking in the summer or the hot environments. All right, so this is the environmental factors, how the drug is being affected by the daylight and the nighttime. Then emotional factors. Oh yes, whether the patient is in like happiness or sadness, or whether he is in a depressed condition, or whether he is highly stimulating condition. Okay, so generally we see that the females are more emotional than the men. Of course, the reverse is also true at times. Men are more emotional than female. Okay, but here, because of those emotional conditions also, the absorption of the drug is going to be varied and the dose will also be related. Okay, so generally when we go for the psychiatric doctors or psychiatric physicians, they would be asking all the mood swings of the patient, at what time the patient is like very happy, and then at what time the patient is dull, at what time they are sleeping, whether the sleep is continuous or disturbed sleep. Okay, and what are their thought process when they really wake up during the sleep time in the night. All right, so all those things they will be asking because they would like to know what is the emotional condition of that particular patient. Okay, so suppose most of you suppose if I have asked a patient, just I have given a placebo. You must be knowing about the placebo. Placebo, in general terms, we call it as a dummy drug. That means there won't be any API, active pharmaceutical ingredient in that. We just give that particular drug to see that whether the patient is satisfied with that or not. Okay, because sometimes the patient feel like only after taking the medication I am happy. Okay, so if you give the placebo and still if the patient is happy without having the active pharmaceutical ingredient, then the emotional factors is definitely affecting the dose of the drug. Okay, that is how we see how the emotional factors affect the dose. And then next factor we have is the presence of a disease. Yes, absolutely. When a patient is suffering from any particular disease, at that time also the dose have to be altered, or though the dose have to be changed. Okay, so for example, the patients with the liver cirrhosis. Okay, what is the main objective or main functioning of the liver? It is the metabolism of the drugs. So whenever the drug has been given, it will be metabolized inside the body. Metabolism, the first year students, please don't get panic by not knowing all these terms. Metabolism is nothing but breakdown of larger molecule of the drugs into the smaller molecules and then slowly excreting from the kidneys. That is what you remember here as per the metabolism. Other classes would definitely know what metabolism is. Okay, so the liver, it is a main organ which is involved in the metabolism. Suppose if there is a liver cirrhosis, that means a disorder of the liver, the drugs may show the prolonged action. Okay, because the liver is not able to metabolize the drug properly. For that reason, the drug is staying inside the body for a longer time and it is not being excreted. Unless and until it gets metabolized, it cannot be excreted. Okay, so after metabolism only it can get excreted. You just remember this point at this point of time, because why it has to get metabolized, why it is not getting excreted, it is again a very big science there. Okay, right. And then the drugs like barbiturates and chlorpromazine have this particular type of the problem. Whereas the drug called as a streptomycin, it usually gets excreted through the kidneys. But if any patient is having a kidney disease, okay, if any patient is having a renal disease, then what happens? The kidneys would not work properly and they cannot send this streptomycin from the body clearly. So what happens? It will stay for a longer time. And if we don't know that the patient is suffering from the kidney disease, if we keep on giving the usual doses, there will be accumulation of the drug inside the body, which causes the toxic effects. We'll see about all those accumulation and all those. I think next only we have the accumulation. Yes, absolutely. So here is a accumulation. So accumulation is nothing but when repeated doses of the drug is being given, there will be some stock of the drug that is present. So here if you see the above one, the purple color one, the graph that I have given is a single dose of the drug. So the drug, it reached the Cmax and then slowly it is getting excreted from the body, and here completely it has been excreted from the body. However, here the green color graph that I have given here, it is a repeated doses of the drug. Yes, for chronic diseases like diabetes, hypertension, I have to give the repeated doses of the drug to maintain that pharmacological action inside the body. Is it not? So here first dose has been given, it has reached the Cmax, then came to the minimum. And again second dose reached and down. Then like this, there is a repeated doses of the drug that has been given and there is a accumulation of the drug that is present inside the body. So if you don't judge or if you don't decide at what interval the drug has to be given, okay, at what interval the drug has to be given, if you don't give it properly, then definitely the drug accumulation is going to happen. So here it is coming to the minimum and then it is going to the maximum. So just let me show you one thing here. There will be, so take this as a plasma concentration time profile. There will be three areas here: minimum effective concentration and maximum safe concentration. So this is called as a MEC. That means minimum effective concentration. That means after this particular concentration only, the drug can show the therapeutic response. And the final one here is the maximum safe concentration. So what is this maximum safe concentration? Till this one only, the drug is going to show the therapeutic action. Above this, it is going to show the toxic effects. Okay, so between MEC and MSC, it is called as a therapeutic range or a therapeutic response. Okay, so here if you see, if I say here it is as a minimum effective concentration. So the drug is coming below the minimum effective concentration. The concentration of the drug inside the blood is coming below the minimum effective concentration. Suppose if you repeatedly give the doses, what happens? The drug may not come below the minimum effective concentration and it may present like this and it shows the accumulation of the drug. Okay, I think you have understood what actually the accumulation is. So Here, instead of dose, the dosing interval is very important. That is why in the dosage regimen, we show the combination of both the dose as well as the dosage regimen. And then the next effect is the additive effect. So additive effect is nothing but here, why I have given the colors is, see, when red color is combined with that of the blue, it is giving pink color. Okay. And then when red is combined with that of the green, it is giving yellow color. And when blue, it is combined with the green, it is giving light blue or teal color, I can say. When red, blue and yellow, three are mixed, then it is giving white color. That is called as the additive effect. Okay. So if 1 plus 1 is equal to 2, then it is called as the additive effect. So if two drugs are mixed together or administered together, if their pharmacological action is more than their individual pharmacological action, then it is called as a additive effect. So here you can see total pharmacological action of two or more drugs administered is equal to sum of their individual effects, right? So example is ephedrine and aminophylline, which is used in the treatment of the bronchial asthma. And the next effect we have is the synergistic effect. 2 plus 2 is equal to 5. Yes, are you sure, madam? Or is there any printing mistake here regarding the 2 plus 2 is equal to 5? No. Mathematically, it may be wrong. 2 plus 2 is equal to 5. But pharmacologically, here to understand about the synergistic effect, 2 plus 2 is equal to 5. Absolutely. Okay. So that means the combination of two or more drugs when there is an increase in the pharmacological action. Okay. For example, take a relay race or take some normal running race. Okay. Suppose if I ask you to run for half a meter and I asked your friend to again run a half a meter separately. However, I asked you to run together by holding the hands. Okay. So what happened is you have that confidence that your friend is along with you and you can go faster than you could go individually. Okay. Or else the new students, the first year students, if principal sir or principal madam have called you individually, you would feel afraid of going to them. If you were called along with your friend, you won't be that much afraid to go because you have the power of your friend. You have the support of your friend beside. So that is called as a synergistic effect. Okay. So here the example is combination of procaine and adrenaline, which is going to increase the duration of action of the procaine. And then the next factor we have is the antagonism, that is opposite to the synergism. If the presence of one drug is going to reduce the pharmacological action of the another drug, then it is called as antagonism. So milk of magnesia in the treatment of acid poisoning. Suppose if any person has taken by mistake acid, they have intake the acid, immediately the milk of magnesia would be given, which is going to suppress the action of the acid inside the body. So there won't be much problem with this particular acid that has been taken by the person. Okay, so these three should not, you should not get confused about the additive effect, synergistic effect and antagonism. Okay, if you're not clear enough, please post it in the chat box so that we can discuss it at the end of the webinar. And the next factor we have is the idiosyncrasy. Okay, so idiosyncrasy is nothing but instead of showing its usual pharmacological action, if it is showing any other action, then it is called as the idiosyncrasy. Usually we call it as an allergy. Okay, usually we call it as a allergy. That's why whenever you go to the physician, they would ask you, are you allergic to any food or are you allergic to any medications? Because that is also going to affect the dose, calculation of the dose. And then the next one is the tolerance. Tolerance is nothing but when a huge dose is required than that of the usual dose to show the same therapeutic response. Suppose, again, we take the paracetamol, 650 mg of the drug is enough to show the pharmacological action. If I'm not getting, if my fever is not subsiding with 650 mg, If I require more amount of the drug to reduce the fever, then it is called as a tolerance. That means my body has got tolerated with that of the paracetamol. So the usual doses are not sufficient to show the pharmacological action. Best examples are the smokers who can tolerate the nicotine. How much ever the smoke they take, the nicotine percentage would not be reached. And then alcohol. The people who are alcoholic, for them, the sedation may not go properly. Sedation, like during any surgery or something, if they have to be given with some anesthesia, anesthesia dose have to be given more for the people who are alcoholic than the non-alcoholics. Okay. So here there are two types of tolerance: true tolerance and pseudo tolerance. True tolerance is nothing but which we get only with the oral administration. However, pseudo tolerance is both with oral as well as IV administration. Next one we have is the tachyphylaxis. So what happens is the repeated doses of the drug which has been given to a patient. Generally, there will be certain vehicles inside the body called as the receptors, which are responsible for taking these drugs to the target area and then let them show their action. Okay. So repeated administration of the drug, what happens is they are going to block these receptors. All the receptors would be occupied. So when all the receptors are occupied, it cannot show the pharmacological action. The free drug, whichever is present in the body, it is not going to show the action. So by seeing that, you should not misinterpret that, okay, I will give excess dose of the drug so that there would be the pharmacological action. No, Baba, already the receptors are saturated with the drug. How can you give the more this so how can you give the more amount of the drug when already the receptors are occupied with that of the drug? So that is what here it is given. Pharmacological response cannot be reversed by increasing the dose. Example is the ephedrine. And then last factor that we have is the metabolic disturbances. Metabolic disturbances is nothing but if there is any change in the metabolism of the body or electrolyte balance in the body or acid base balance in the body or the body temperature. That means if your body is not in the normal condition, if any metabolic disturbances are there, like if any hormonal imbalance is there inside the body, okay, then also the dose of the drug has to be altered or the dose of the drug has to be changed. Okay, so I think till metabolic disturbances, we have come across all the 16 factors affecting the dose of the drug. So all these are the factors which are going to affect the dose, and each and every factor have to be considered. It may not be considered for very primitive type of like dose calculation or something, but all these factors are going to affect the dose of the drug. Then the next important part is the calculation of doses. This is what actually the posology is it not? So here the calculation of doses is nothing but, as we already discussed, the average dose of an adult would be given in the pharmacopoeia. So from that you have to calculate the children doses. And the doses will be based on age, body weight, and body surface area of the patient. So first let us see what are the formulae that are present to calculate the dose of a child based on age of the patient? Okay, we have 5 formulae. The first one is the Young's formula. So the Young's formula, it is used for the children who are below the 12 years of age. Okay, so the dose for the child is equal to age in years. Whose age? The patient age. Okay, age in years divided by age in years plus 12 multiplied by adult dose. Why the adult dose here? Because this is the dose which would be given in the official pharmacopoeias. So this particular Young's formula will be used for the patients who are below 12 years of age. Remember, this is very important when you calculate the doses, especially during your exams. Okay, you should not get confused there. Then the second one is the Delling's formula. So this Delling's formula is for the people who are from 4 to 20 years of age. Okay, 4 to 20 years of age. So dose for the child is age in years divided by 20 into adult dose. And then the third one is the Cowling's formula. So this Cowling's formula, there is no restriction. You can use for any age of the patient, that is from 2 years to 20 years of the age. So dose for the child is equal to age at the next birthday in years. That means present age plus 1 you can keep it as. Divided by 24 into the adult dose. And then comes the Freed's formula. This Freed's formula is especially used when you are calculating the doses for the child whose age is in months. Months baby we call them as. Or in the problem, if they give you the age of the child as months, you can take this. So the dose for the child is equal to age in months divided by 150 into the adult dose. And then last formula related to the age we have is the best dose formula. Dose for the child is equal to age in years plus 3 divided by 30 into the adult dose. So all these formula, Young's formula, Delling's, Collins, Freed's and the best dose, all these are related to the age. Okay, depending upon the age, you can calculate. You can take a screenshot of this slide to easily revise every day morning what are these formulae. Okay, and then coming to the dose calculation based upon the weight, only one formula we have, that is the Clark's formula. So the dose for the child is equal to weight in pounds, my dear children. Please remember here, the weight is not in kgs. Here it is weight in pounds divided by 150 into adult dose. So if in a question, if they directly give you as the weight of the patient in lbs, pounds is also called as a lbs, okay? If they directly give you in pounds, then you can directly substitute that here in the numerator and you can calculate. However, if the weight of the patient is given in kgs, first you have to convert that kgs into pounds and then you have to calculate the dose for the child. So 1 kg is equal to 2.2 pounds. Please make a note of it. Okay. And then the third criteria is dose proportionate to body surface area. Why we have to calculate the dose based on the body surface area is it is suitable in two conditions. Okay. So the first condition is for the patients who are receiving the cancer therapy, chemotherapy for the cancer patients, and the second one is pediatric patients of all the childhood except the premature and full-term newborn babies. Except the premature and full-term newborn babies, like the people who have born in the at the end of the 8th month, like that. For those pediatric patients also, you can use the body surface area because we doesn't know the exact age or weight will also be not improper for such condition, for such people. Okay, so the formula we have is dose for the child is equal to body surface area of child divided by body surface area of adult into adult dose. So to simplify this, we directly given the body surface area of the adult. The body surface area of the adult is 1.73 square meters. And by just substituting the body surface area of the child, you can get the dose of the child. Okay. So these almost 5 in the age, 1 in the weight and 1 in the body surface area. Total 7 formulae you have to calculate the dose of a child. Usually you get the questions from age as well as the weight. So based on that, I have given few practice problems here. Like I just go quickly with these problems. So the first one is if the usual adult dose is 60 mg, what is the dose for a child of 6 years and 8 years? So when we go back to the formula that we have given under the weight, calculation proportionate to the age, you can go for the first formula, that is Young's formula, because here the age of the child is below 12 years. So age in years, that is 6 divided by age in years plus 12, that is 6 plus 12 multiplied by 60. Okay, like that you can calculate. So 6 by 6 plus 12 multiplied by 60, you will get it is at around 20 mg. So for a child who is of 6 years age, the dose should be given as 20 mg. In the same way, you please calculate it for the 8 years as well. And then the second one is, if the adult dose of allopurinol is 200 mg, what is the dose for a child of 12 years and 16 years? So we can go with the next formula here. That is the where the dose age in years divided by 20 into the dose of, into the adult dose. So 12 divided by 20 multiplied by 200. It gets around 120 mg. And then here, the adult dose of a drug is 50 mg. How much is to be given for 6 months old and 24 months old infant? So as it is given in months, so you have to go for the formula, that is age in months divided by 150 into adult dose. So 6 divided by 150 into 50, you would get it around at 2 mg. Okay. And then the next one is, the adult dose is 100 mg, and how much it has to be given for patient weighing 12 lbs and 15 lbs. So directly you can go for the Clark's formula here. So as it is directly given in pounds, you can directly substitute it. Okay. So 12 divided by 150 into 100. You'll get it around 8 mg. However, if it is given in terms of kgs, then you have to convert that into the pounds and then you have to calculate. Okay. So these are very simple problems, and yes, like this type of problems only you will be getting in the competitive exams. Here it would be very simple, because after hearing to 1 hour of the lecture, you will be having everything in your brain and you can easily calculate. But during the exam, you have to remember, like for example, here, if you take either Young's formula or the Cowling's formula, you may not get the exact result which you get by taking the age in the months. Okay, so that switching off should be there. Which type of the formula has to be used for which age group of the patients or the weight of the patient. So this is all about the posology today. In today's webinar, we have seen what posology actually is, and then what are the various factors. My dear children, we have seen about 16 factors. Okay. And then what are all the various formulae that are there, and you have you have just calculated and you have just confirmed whether you have understood the webinar properly or not. Okay. So this ends the webinar here. And if you have any doubts, you can please post it in the chat box.